the presentation at the Congress as structured as a debate. I think that as it played out, it proved that it wasn't much of a debate at all. Maybe a commiseration that we're pulled in so many different directions, and there's, transportation issues, and there's patient education issues, and that all factor into who takes care of which patient, when, and where. You do the best you can with what you got and where you are. In a perfect ideal situation, if you have someone with a colon complication and you have a surgeon who's done thousands and thousands of colon surgeries and they can perform that operation, awesome. But there isn't always that surgeon in the area where the patient needs them. And they do have capable surgeons who have maybe different experience, but not better or worse. I think that everyone agreed that, you do the best you can, and you keep the patient in mind.
There's a difference between competency and expertise. And so I think most of us would say that if it was ourselves or our patients, we want an expert dealing with things if possible, balancing that with the acuity of the situation.
Where the art comes in is, what is that time cutoff? And we love to have rules and spreadsheets and flow charts that tell us exactly what to do and when to do it, but that doesn't always exist. And is the specialist 1 hour away versus 5 hours away? And is this patient in florid septic shock versus somebody who's in the early stages of a disease? And you have to weigh all those, and it's difficult because there is no one right answer. The bottom line comes down to communication. So communicating both surgeon to surgeon, surgeon to staff, and communication with the patient, that their needs are going to be adequately cared for, is important.
I think it is important for colorectal surgeons to be available for consult, either by directly overtaking the care of that patient, or even sometimes you just need to run something by someone. And that's also a role that I think colorectal surgeons can play if there's not a situation where you can get them to a specialized center or somebody that's specialized, being able to kind of run the case by somebody who maybe is an expert to ensure that you've thought of the same types of things that they would think of, and collaborating with each other, right? Like, this is where we can help each other, somewhere in the middle.